I hope you had a chance to check out Martin Smithson's sales webinar earlier today. If you didn't, you'll be able to find it on the ACDI YouTube channel, posted with this one. While checking out the sales webinar, I took note of the various features mentioned for both a small doctor's office to a large hospital using enterprise systems, and this is what healthcare organizations are wanting to do. Administrators need to know the who, what, where, when, why, and how people are printing. They want to be able to use any device, whether company owned or a device they brought in. To satisfy HIPAA regulations, print jobs need to be secured, only released when the user is there to collect the document. Doctor offices can be scattered around with printing happening anywhere and everywhere. They need a cohesive strategy for using PaperCut at all locations. Many times the jobs need to be tagged to an account or department for proper accounting. Informative print pop-ups can help deliver print jobs to the right printer or provide needed information about the job. Print suggestions and information can be critical to provide staff with an immediate status of their printouts. And they need to be able to move those documents electronically throughout the hospital for other medical professionals or even patient access by scanning to different internal and cloud locations. However, those locations need to be secured to prevent PHI from just going anywhere. Many hospitals use EMR systems and need sustainable integration. We'll take a look at the possibilities there. Pay attention, as we'll have a trivia question at the end of the presentation with your chance to win a very cool ACDI t-shirt or polo. Tracking of print jobs is a core feature from PaperCut, so there's no extra licensing or module needed. It comes with the software and grabs information from each output stored in a database for later retrieval. If you're new to PaperCut, then know that in many instances we can use the built-in Apache Derby database. This open source software can be used in locations of up to about 5,000 users or so. If there are more, or if the hospital desires, PaperCut can be run on just about any other database. MySQL, Postgres, Oracle, and SQL Server are just a few of the other options. If a hospital or doctor's office has specific requirements for software to be run on their own instance, then PaperCut is flexible enough to allow connectivity with any system. Tracking is an automated process within PaperCut, and you can track as many printers as you want. There's no licensing limit. This includes printers that are set up as direct IP printing. The direct print monitor comes with PaperCut, so you can track local devices like USB printers, as well as workstations that print directly to a multifunctional device or printer. There's no other license or fee for that. Comes standard with PaperCut, and you can track as many printers as you want. It's really easy too, as all you need to do is install a print provider on the server or workstation, and voila, you'll start tracking immediately. All printers just show up in the PaperCut admin console. There's nothing that you need to do to make them appear. Plus, it just works. Many doctors today are mobile and work out of their office and hospital, often using their own device as they move around. Mobility Print comes to the rescue here, another included feature set of PaperCut. You may have heard me talk about this, especially recently, as Mobility Print is the replacement for Google's Cloud Print, even featured on Google's webpage. This easy-to-use feature of PaperCut can be set up for free if you don't need authentication and only need a mobile print platform. Add PaperCut MF to it for a full authenticated system that will not only track the prints from any device, Windows, Mac, iOS, Android, or Chromebook, but also will let you set up a secure or virtual queue for the prints. We'll talk more about secure print on the next slide. Seriously, if you've not looked at Mobility Print, you're doing yourself and your customer an injustice. This platform is very robust, yet easy for the end users to set up their own devices. Videos, written instructions, and any required downloads are all presented in a single web page that simplifies the installation. We have grade school kids using Mobility Print. Check it out for yourself. Another core feature of PaperCut is secure print release. And I'll also include Find Me support with this topic. No extra modules or license needed for this to work either, and there are many ways to release your jobs. Of course, the easiest is to have embedded software on the MFP, and PaperCut works with just about every OEM. With a device license, you're not restricted by a user count and can have as many as you need. Plus, you gain the benefit of also tracking copies and scans to get a full picture of your environment. If PaperCut already exists and you are replacing like for like, you don't have to worry about licensing, as PaperCut doesn't care about the specific device, only the quantity of that manufacturer. If you are replacing other OEMs, then there is a discount available for the new connector needed. Other ways to release your job includes using a release station or a workstation with a release station software installed for an end user to access. Managers can also release jobs that are held in a PaperCut queue. Plus, there's a free mobile release capability where you could put a QR code on the copier and users can utilize their mobile devices to release. No charge for that, included with PaperCut. And Find Me is the same thing as secure print release, with the exception of printing to a virtual queue. When a user selects the print job at the release station or multifunctional, PaperCut will then redirect from a virtual to the physical queue of the device the user has requested. This is why you need to take a little care when setting up Find Me queues to ensure that they are using the same language and are compatible with each other. I've typically had better luck with PostScript drivers and tend to stay away from universal drivers whenever possible. That should help you out when determining which driver or drivers to use in the customer's environment. A very common find in the healthcare space are multiple locations, especially these days with many larger groups taking over the single physician office. You'll find more of this happening. Not to worry, as PaperCut includes any extra server pieces that you need, or you can even run separate application servers at no extra charge. That's the beauty of PaperCut, as most things are included in the software. Before April of last year, only one site server was included in your PaperCut instance. However, that restriction is now removed, and you can run as many as you need, as well as secondary servers. Secondary servers have always been included and might be used in a larger rollout where you have several print servers in one building or are setting up a clustered environment. Site servers provide failover processes so that if the application server is unreachable, users can still authenticate and release jobs as the MFP will still be functional. And if there's no connectivity between sites, then a full application server can be set up at each location. That's referred to as an enterprise license and available for any installation. Check with your ACDI rep for more details or shoot me an email. I'll be glad to clarify. While we don't necessarily find this in smaller doctor offices, enterprise hospitals and healthcare groups may have the need to charge back certain prints to grants, projects, or departments, and need a quick and easy way to do it, whether it's from a workstation or mobile print. Fortunately, PaperCut now provides most OEMs with the ability to select the chargeback account right on the device. Of course, there is the standard and advanced clients that end users can use, providing they are on a Windows or Mac and have the client installed. The advanced client is now unlimited with PaperCut. Used to be a charge if you did not purchase the professional version of PaperCut. Now you can fire up as many as necessary without any license disturbance, and the advanced client provides search capability, as well as favorites, recent selections, and the ability to add a comment to a print job, all at no extra charge. In PaperCut, these are called shared accounts. And while not necessarily a healthcare need, quotas can be set on the entire account so that the department balance will be affected and not the user. Keep that in mind when talking about this feature with other verticals. Another included feature set of PaperCut is rules-based printing as part of the core feature set. No extra module, price, or license. Just turn it on if your customer requires it. Rules-based printing can accomplish things that the built-in filters and conversions can't do. There are many canned scripts, so someone like me, who is not necessarily well-versed on scripting, can actually make a script that works. Print jobs are analyzed by PaperCut, and if certain criteria is met, then an action can be performed. One of my favorites is when Outlook is being used. Emails can be converted to grayscale automatically, and this script doesn't even require the client to operate, although most scripts do need to have the client installed. There are Mac versions of the client available that actually work. Remember, PaperCut can install on a Mac operating system or Linux. Software does not require Windows, IIS, or SQL Server. Of course, the majority of installations are done on Windows, and the client can be pushed out via GPO, and MSI package is included. Login scripts will work too. If there are more complex needs, then please engage your ACDI rep, as we have developers on staff that can create customized scripts to accomplish just about anything. Many devices can now test out device scripting, available with the current version of PaperCut. More capabilities will be rolling out, as well as more OEM support shortly, as controlling an MFP is much different than working with a spool file. Available on almost every OEM now is integrated scanning. This is a streamlined convenience scanning capability to allow users to scan to an email address, Windows home folder, or a static network destination. Integrated scanning included cloud destinations recently, with an uncomplicated interface that makes it easy for end users to scan to their favorite cloud destinations, as long as they're approved by the internal PaperCut administrator. Each scanning destination allows for a security access control list by either user or group. With a couple of clicks, the admin can create a destination that only certain people can access. Important when thinking about hospitals, patient information, and HIPAA violations. Cloud destinations include Google Drive, Dropbox, Box, pCloud, SharePoint, and OneDrive. Scans go to a PaperCut folder in each repository and are authenticated by a one-time email that links their account to the cloud storage. A token is held on the PaperCut server for subsequent scans, so even if an end user changes their password, they'll be able to scan to the cloud without a hiccup, as they've already approved access to that folder. Easy to set up, easy to use. This is a win-win for everyone. And now for what you may have been waiting for the last, 15 minutes or so to hear about, EMR integration. Wait a minute. PaperCut is only for education. How does this happen? Well, it does happen. And many healthcare organizations are finding out that they can use PaperCut as their print management system and set up easy-to-use, secure release, as well as other feature sets. This is a lot like any enterprise system. And while there are too many variables to discuss at length during this webinar, let's just say that it can be done. First, I'll direct you to a quick blog on the PaperCut site written by Matt Buttry, a direct sales manager for PaperCut. In it, he discusses Epic. Stay tuned, as we have an announcement coming soon about a tighter integration with Epic. Plus, there is a really nice article on Cerner printing in the PaperCut knowledge base, www.papercut.com/KB, as in knowledge base. Just search for Cerner and you'll find a guide to easy and secure Cerner printing with PaperCut. This article, like all of the KBs, is well written with graphics of local printing and typical installations with Cerner. Same will hold true for most EMRs. The basics of printing with any EMR is that we need to have the PaperCut print provider monitor the spool files. If we can install on the server, that's fine. If we need to redirect to a Windows server for tracking, then so be it. The other item to consider is whether or not the username is contained in the header of the job. If it is, then we can do advanced things like secure release or find me support. If it isn't, then this may require a regular expression to be written that'll extract the data from the file. And of course, ACDI has experience with this, so all we need is a couple of good spool files from the customer to determine the capabilities for them. Again, we're here for you, so please engage us. That's what we're here for. There's another new feature of PaperCut that can come in handy when planning your rollouts, and that is print deploy. PaperCut can now roll out drivers automatically based on the location of the user with no interaction needed by the end user. The basic edition comes with PaperCut, and advanced features are available in a premium extension pack. Your ACDI rep will have more details on that. So, PaperCut is just for education, right? I hope you're not feeling that way anymore, as there's many features that healthcare customers want and need, and PaperCut is there for them with easy-to-use software that really works. Remember, PaperCut is device-neutral software that can be installed on Windows, Mac, Linux, and Novell. Virtually everything you need comes with PaperCut, as very few items are actually a la carte. ACDI is your one-stop shop for all things PaperCut, and I appreciate you joining me once again. If you have questions or comments, please reach out to me via email. My address is thedoctor@acd-inc.com. And make sure to check out What's the Solution from ACDI. Our podcast is on all your favorite platforms, and I look forward to your comments on those as well. Time to wrap things up for today. Q&A coming up for those of you live, and of course, our trivia contest. Thanks for joining the ACDI Technical Webinar. I'm the doctor for ACDI.